I know your back has been bothering you more as you get older, and it's not your fault. Back pain after 45 is extremely common because our spine and muscles naturally start to lose flexibility and strength. Many people think it's just aging and that nothing can be done, but the truth is small changes in daily habits can make a huge difference. One major cause of back pain is weak core muscles, and by core we don't just mean your abs but the deep muscles around your spine and pelvis. Strengthening these muscles can stabilize your spine and reduce strain even when doing normal activities like bending or walking. Simple exercises like pelvic tilts, bridges, or gentle planks can activate these muscles without overloading your back. Start with just a few repetitions each day, and gradually increase as your muscles get stronger. Another big factor is poor posture, especially if you spend time sitting, bending, or using a computer. Slouching for years puts pressure on your spinal discs and weakens the muscles that support your back. Even small posture corrections, like sitting with your shoulders back, feet flat, and head aligned, can relieve pain. Using a small rolled towel or lumbar support behind your lower back when sitting helps maintain the natural curve of your spine. Standing up and walking for a few minutes every hour also prevents stiffness and keeps blood flowing to your muscles. Many people ignore flexibility, but as we age, tight muscles like hamstrings, hip flexors and glutes pull on the spine and cause discomfort. Daily stretching, even 5 to 10 minutes, can improve your range of motion and reduce pain. Try gentle stretches like seated forward bends, lying knee to chest or cat-cow on the floor. Breathing deeply while stretching relaxes your muscles and improves oxygen flow, which supports recovery. Weight management is another often overlooked factor in back health. Extra weight, especially around the belly, shifts your center of gravity and increases pressure on your lower back. Even losing a few pounds gradually can reduce this pressure and make movements less painful. Nutrition also plays a role in spinal health. Foods rich in calcium, vitamin D, magnesium, and omega-3 fatty acids help maintain bone strength and reduce inflammation. Dairy products, leafy greens, fatty fish, and nuts are great examples of these nutrients. Avoid excessive sugar and highly processed foods because they can increase inflammation and worsen pain. Hydration is important too because spinal discs need water to maintain cushioning between vertebrae. Drinking 6 to 8 glasses of water daily helps your discs stay flexible and healthy. Sleep position can either relieve or worsen back pain. Sleeping on your back with a pillow under your knees or on your side with a pillow between your knees supports spinal alignment. Avoid sleeping on your stomach, as it increases the arch in your lower back and strains muscles. Regular low-impact exercise, like walking, swimming, or cycling, strengthens muscles, improves circulation, and reduces stiffness. You don't need to overdo it. Even 20 to 30 minutes a day can make a huge difference. Mind your lifting techniques because bending incorrectly causes many back injuries. Always bend your knees, keep your back straight, and hold objects close to your body. If you already feel pain while lifting, stop immediately and rest. Stress and tension can also worsen back pain, because tight muscles and inflammation increase when the body is stressed. Simple stress reduction techniques like deep breathing, meditation, or even listening to music can relax your muscles. Heat therapy, like warm baths, heating pads, or warm compressors, relaxes tight muscles and improves blood flow. Cold therapy, like ice packs, can reduce inflammation after sudden pain or strain. Alternating heat and cold is often very effective for chronic back pain. Check your footwear because shoes with poor support or high heels alter your posture and increase back strain. Choose comfortable shoes with good arch support and cushioning for everyday use. Core and back muscles weaken faster if you are sedentary, so avoid sitting for long periods without movement. Consider a standing desk, or set a timer to remind yourself to stand and stretch. If pain persists, professional help is important. Physical therapists can design a personalized exercise and stretching plan that targets your weak muscles. Chiropractors, osteopaths, or certified trainers can provide additional guidance on alignment and strengthening. Sometimes imaging tests like X-rays or MRIs are needed to identify structural issues, but most back pain is muscular and improves with conservative care. Avoid heavy painkillers as a first resort because they treat symptoms but not the cause. Instead, use natural anti-inflammatories like turmeric, ginger, or omega-3 south, but always check with your doctor before starting supplements. Post-surgery or injury recovery requires extra care, and exercises should be approved by a professional. Daily consistency is more important than intensity. Small improvements every day compound into significant relief over time. Keep a pain journal to track what activities increase or decrease discomfort. This helps identify triggers and effective strategies. Remember that even small posture improvements, gentle stretches, and strengthening exercises can drastically reduce back pain within weeks. Social support and accountability help, so involve a friend, family member, or join a local exercise group for motivation. Breathing techniques during exercise or stretching also protect your spine and reduce unnecessary tension. Avoid prolonged bed rest, because staying immobile weakens muscles and slows recovery. Incorporate balanced exercises like standing on one leg or gentle yoga to improve stability and prevent falls. Hydrotherapy or swimming supports your body while reducing impact on the spine, making it excellent for seniors with pain. Heat, cold, stretching, strengthening, posture, nutrition, hydration, sleep, and stress management together create a holistic approach to back health. Many people see improvements in as little as 4 to 6 weeks with consistent application of these strategies. Avoid thinking it's just aging because evidence shows lifestyle changes have a significant impact on reducing back pain. Regularly review your habits and gradually increase your activity, stretches, and strength exercises as tolerated. Celebrate small victories, like walking longer without pain or sleeping better at night, as these are signs your body is responding positively. Seek medical advice if pain radiates to legs, causes numbness, or is severe and persistent. Otherwise, follow these strategies consistently, and your back can feel stronger, more flexible, and less painful. Remember, prevention is always better than reaction, so incorporate these tips into daily life even before pain becomes severe. A combination of movement, posture, core strength, stretching, hydration, nutrition, stress management, and professional guidance is the safest, most effective plan for back pain after 45. Your body is capable of significant recovery at any age if given the right support, care, and attention. Commit to daily habits, monitor your progress, and stay consistent, because over time, these small steps result in dramatic improvements. With patience and persistence, you can regain comfort, mobility, and confidence in your back.